Is your brain vulnerable? What does that mean? And what can you do about it? So I wanted to mention this concept of a vulnerable brain. It came up the other day in my office. If you haven't watched before, I'm a geriatrician. So I'm an internist with extra certification and specialization in looking after older adults. I see a lot of people with brain disorders like Alzheimer's and Parkinson's disease and other things. So I was meeting with a patient of mine and his wife was very frustrated. She was scared. A couple of times, 2 separate occasions, which were months apart, her husband had had a dramatic change in his behavior. He became really paranoid and worried, which was unlike him. He thought there were people in the house. He was so convinced of this that he couldn't rest. He kept checking the windows and doors. He wanted his wife to call the police. It was really disruptive and upsetting. In the end, on both occasions, his wife took him to the emergency department and he had some investigation which revealed that one time it was an inadvertent overdose of one of his medications, which was a pain pill, and the other time it was an infection. But Fred, we'll call him, Fred's wife was really scared. She wanted to know why this had happened and how to prevent it from happening again. And why was it that on each occasion it wasn't really obvious that the reason why his brain was acting this way was because of an infection or a medication? How come it's not easy to detect these things and avoid them? Myrna was afraid that this was going to happen again, and she wanted to know what to do. So we had a discussion about the vulnerable brain. Myrna's husband, Fred, does have kind of a complicated medical history. He's living with liver failure, which he has because he has hepatitis that he got from a blood transfusion when he was having some emergency surgery 20 years ago. He's also been diagnosed with dementia, and he's living with chronic pain. So he's on quite a few medications that, if they're not taken exactly right, could cause some side effects that could lead to confusion. All of this added up together means that Fred's brain is vulnerable. It doesn't take much for Fred to have some confusion or maybe hallucinations. And, that's a typical thing in geriatrics. There's sort of a saying that the organ that shows up with an illness is not the organ that's sick. Or the medical way of saying it would be that the organ of presentation is not the organ of disease. So what that means is if an older person with a vulnerable brain comes in with brain symptoms, it might not be because of a brain problem, like a stroke. It might be because of something that's wrong in the bladder, for example, like a bladder infection, or the kidneys, or the liver. So that makes things more complicating. And it is very frustrating for families and for healthcare providers too. People who have a vulnerable brain need a special approach. That's what geriatrics is all about. Vulnerability is a common concept in geriatrics. I would say it's one of the core concepts. So you might have heard me talk about frailty before, and frailty is actually a state of increased vulnerability. It basically means that there's less reserve in case there's some perturbation, like even a minor illness or a change in medications or change in environment, for example. It just means that the person or the organ system in question, whether it's the brain, the kidneys, the muscles, the balance system, that system just can't really handle those types of shakeups. It can be a frightening way to be. But, we do know, for example, in the case of delirium, people who are vulnerable to delirium can do some things to prevent the delirium from happening. If we know that the person has a vulnerable brain or another vulnerable system, or is just overall vulnerable, like falls into that definition of being frail, then we can kind of treat them with kid gloves, so to speak. We can also maybe check into some things a little bit sooner. So if we notice a change in behavior, we can review the medications right away to see if there have been any changes or misadventures. We can screen for infection rather than waiting for the symptoms of infection to come on. So a heightened awareness that someone is vulnerable can prevent some of those exacerbations or worsenings that Myrna was so worried about. If you want to know more about frailty, vulnerability, or aging in general, subscribe to our channel and go to www.thewrinkle.ca.